A resolution recognizing April 5th to April 11th as National Public Health Week.
Yeah, and Susan, I don't know if you're back again or somebody else from the health department, but boy, if there's ever a time to celebrate National Public Health Week, this is the year.
Susan's online.
Oh, good, Susan. So we will have Yolanda present it, and we all expressed lots of gratitude yesterday, but we want to keep doing it. I think we should do it every day. Because what you have done and your crew and your ability to maneuver a very difficult time is just incredible and saved so many lives. I just can't say enough about how important this health department under your leadership has been. And I know we're celebrating Public Health Week around the country, and you are multiplied hundreds of times, people out there, thousands of times, people out there doing this incredible work at one of the most challenging times in anybody's history. So there's a recording that we're going to have of Yolanda reading the proclamation, and then I'll open it up to other I'm sorry, it's a resolution, so we have to have a motion. But Yolanda, why don't you read it first, and then I'll call a vote, and then we can have other people speak.
President Scorman, I sent you an email with the persons that are going to be presenting, Kim and Lisa.
Okay. I'm sorry, I didn't see that. Yeah.
Yeah, I texted you about it as well. So I think that we can do the resolution, hear the resolution, and then make a motion, and then all of us can talk.
Oh, okay, good. Okay.
But I'd be really grateful if you would introduce.
Introduce yourself. Sorry, I didn't realize you were there.
Okay, so we have Kim and Lisa here. Okay. So we can start the recording. I'll pretend that I'm talking right now.
Okay.
Recognizing April 5th to April 11th as National Public Health Week. Whereas the week of April 5th through 11th, 2021 is National Public Health Week. And whereas public health professionals help communities prevent, prepare for, withstand, and recover from the impact of a full range of health threats, including disease outbreaks such as the COVID-19 pandemic, measles, natural disasters, and disasters caused by human activity. And whereas public health action, together with scientific and technological advances, has played a major role in reducing and, in some cases, eliminating the spread of infectious disease, and in establishing today's disease surveillance and control systems. And whereas the mission of El Paso County Public Health is to promote and protect public health and environmental quality across El Paso County through people, prevention, and partnerships. And whereas the vision of El Paso County Public Health is for all El Paso County residents to live in thriving communities where every person has the opportunity to achieve optimal health. And whereas El Paso County Public Health promotes resiliency, community correctedness, and health to assure the well-being of all our populations and communities. And whereas El Paso County Public Health works to build safe, healthy communities by developing policy and collaborating with multi-sector partners across the county to assure health is a priority in our communities. And now, therefore, be it resolved by the City Council of the City of Colorado Springs, April 5th through April 11th is recognized as National Public Health Week. And to observe this week by helping our families, friends, neighbors, co-workers, and leaders to better understand the value of public health and supporting opportunities to adopt preventative lifestyle habits in light of this year's theme, Building Bridges to Better Health, dated at Colorado Springs, Colorado, this 23rd day of March 2021.
Okay, thank you, Yolanda. Are you going to make the motion to pass the resolution?
Sure, I make a motion to pass the resolution.
Okay, is there a second?
This is Dave, I'll second.
Okay, and Sarah, call the vote.
Well, Could we have people talk before we do?
Oh, you want to have them talk before? Okay, good. Okay.
Would you introduce Lisa or Kim?
Yeah. So go ahead. And, if you'd like to introduce them, go ahead, Yolanda. Please do. I'm sorry, I'm a little out of it today, everybody. I just been emotional and also been dealing with credit card fraud. So sorry about that. Go ahead, Yolanda. Why don't you introduce them? Yeah.
I have you have the talking points, Richard.
Okay, I just didn't see them. Sorry.
Okay.
Yeah. Let me look and see.
We could start by having our guests, if you'd like to introduce yourselves here at the podium.
Good
morning.
I can introduce them as well and have them say a few words after that, if that might be okay.
That would be great, Susan.
Yeah, sorry about that.
Okay, thank you. For those that are online, I'm Susan Whelan, and I serve as the Public Health Director for El Paso County and Colorado Springs. So thank you so much for having us here today and to recognize local public health in coordination with the National Public Health Week, which starts the first week of April. And there's numerous important public health professionals that are dedicated public health servants, and we have two of our team members here today. And Lisa Powell, if you want to step up, please. She is the manager of Emergency Response and Preparedness Program. Lisa was recently approved by the Certification Commission during October 2020, the review to receive the Certified Emergency Manager credential. This credential designation is the highest honor of professional achievement available from the International Association of Emergency Managers, which has in its membership more than 6,000 emergency managers representing professionals whose goals are saving lives and protecting property and the environment during emergencies and disasters. Lisa and the Public Health Emergency Preparedness and Response Team have been the foundation for El Paso County and Colorado Springs' swift response to the pandemic, helping set up and mobilize core areas such as COVID-19 testing sites, managing vaccine supplies and distribution plans, including points of dispensing, helping manage the safety and flow of vaccination clinics and volunteers. As part of the U.S. National Response Framework, they have led efforts of public health planning, training, and exercises for more than a decade, from tabletop to full-scale functional exercises with numerous healthcare and first responder professionals, which has been imperative to fighting the COVID-19 pandemic. They serve a 5-county region, including El Paso County, helping communities throughout the South Central region plan and prepare for disasters. And Kimberly Patterson, if you want to step up. Kimberly Patterson is an epidemiologist and the manager of our communicable disease program at El Paso County Public Health. The communicable disease program monitors and investigates more than 60 different diseases in the community with the overall goal of prevention, limiting and stopping the spread of disease, protecting human health. Kimberly oversees a team of dedicated epidemiologists and disease intervention specialists who have been instrumental in the COVID-19 emergency response efforts. They have been working around the clock, 7 days a week, 24 hours a day, to help mitigate the spread of disease through contact tracing and providing quarantine and isolation recommendations. This team also provides extensive technical expertise and guidance to businesses, schools, and many sectors on how to slow the spread of disease. These are just two of the many remarkable public health professionals in El Paso County and all of the 8 towns and cities, including Colorado Springs, who work tirelessly, not only on community health, but have been working tirelessly over this past year on the COVID-19 response and recovery, and with coordination of countless partners as part of the overall public health system over the past year. Thank you.
Yeah, thank you, Susan, and thank you, Lisa and Kimberly. I don't know if you'd like to say something. Come on up to the dais if you want to say anything. You don't have to, but we wanted to pass the resolution and give it to you and take a picture. So go ahead.
Thank you so much, Richard. I really appreciate the
the honor today of recognizing public health in this way. We have been, tirelessly and diligently working, not just the two of us, but hundreds of us for the last year on COVID-19. And we're excited that we are able to now maybe see the light at the end of the tunnel with vaccines going out in our community. As a matter of fact, I'm going to be heading back out to get 1,000 vaccines into restaurant workers this afternoon here in downtown area. So thank you again.
Yeah, thank you. Boy, and, the restaurant workers are so excited. I can't tell you how much I've heard about all that. Come on up, yeah. If you'd like to speak, do you want to? You don't have to, but yeah.
I'll just very briefly say thank you to this committee here and for the community approach that we've had for COVID-19. Like your earlier conversation regarding the alternative plans for 4th of July and all the creativity that it's taken to help this still be an amazing place to live even through COVID-19. So my team, we all appreciate that support. Thank you.
Yeah, great. Thank you. All right, so we have a motion from Yolanda, and I would take a second and we'll vote and see if there's any other council member comments.
Yeah, Richard, I think David seconded.
Okay,
I
David.
seconded, and I actually do have a comment.
Go ahead, yeah.
If I might, just before the vote. First of all, you represent a team of dozens and dozens of employees with your department, and in conjunction with hundreds and hundreds and hundreds of people that have banded together over the course of the last year, representing schools and businesses and the business community, hospitals, public service or public safety, first responders. And so while I commend both of you as individuals, I also commend all of them through you. As you all were talking, and as Susan was talking, I was struck by the word public. And how over the course of the last year, we've kind of lost sight of the fact that, like public safety, public health requires cooperation of the public. And we've talked a lot about COVID, but Kimberly, I'm sure that over the course of the last several years, you've dealt with rabies, you've dealt with plague, you've looked at things to address public health for those sorts of things as well. And the public has accepted that because the impact was smaller. This is the same thing, but on a much bigger scale. And you guys have dealt so well with public reaction to dealing with what is essentially rabies on a much more deadly, much more bigger scale. And you've done really well with that. And Lisa, I think about over the course of the last 10 years, you or your position have dealt with public safety responses to the Black Forest fire and Mountain Shadows fires. And those things are understandable and acceptable because we see that it's harder with COVID. So you've been preparing to do what you've done for the last year. And I encourage the public to recognize that this is a public responsibility, just as yours has been a public response, and that the public needs to continue to cooperate with you guys until we do get to that light at the end of the tunnel. So thanks.
Thank you, David. Anybody else like to make any comments?
I would, Richard.
Go ahead, Yolanda, please do.
Thank you. So through this crisis, we have seen that public health throughout the nation has been underfunded, as well as in the state and as well as here, and not realizing the critical need. You all are public servants, Lisa and Kim, and as you're part of a huge team. And before this crisis happened, we were looking at teen suicide, and were able to bring that down significantly before the crisis. And so I just want people to know that public health does so much more in making sure that babies are healthy, moms through the WIC program, looking to contain measles or any outbreaks that are happening, making sure that we get our flu shots. And it's just an enormous array of services that public health provides and how important, and I think COVID underscored the need for the services of public health and what it did for the community and how it affects the community broadly, throughout. So we talked a lot about it yesterday, but I do, Susan Whelan and your team, I'm really grateful for all the work you do and continue to do 24/7. And I'm hoping that you can get back to normal yourselves and just work 5 days a week again. So, yeah, really do. So thank you all so much. And with that, I think, unless Richard, if someone else wants to talk, we can take a vote pretty soon.
Yeah.
Richard, if I could say something here.
Please do, yeah.
And just so you know, we're having some internet connectivity, so you may not be getting messages that someone wants to say something because we can't connect. So I want to comment just a little bit about how nimble and awesome our Department of Health here is, and I appreciate the work that each of you and all of your colleagues have done. But they also ramped up, and they reached out to other resources. So you saw Leon Kelly stepping in to help out, who is normally the coroner. But he also has some epidemiology background. And so rather than sit back and say, oh, woe is us, you guys actually did an awesome job. And I'm very proud of the efforts our community has made, and with the work that you and your colleagues have done. I think when I look at the responses elsewhere, I am so impressed with what has been done here. And when I think of the briefings we've had as a council, I learn more in those than when the fancy highfalutin people are speaking on network TV. And so I have to say, I'm so impressed and so appreciative for all of us in the community who've benefited from your efforts. And I'm grateful that we have a Board of Health that's been supportive of that. I'm concerned when the legislature wants to change those boards of health who have actually been functioning very well. So I appreciate the work, and thank you.
Thank you, Wayne. Appreciate that. Anybody else want to say anything? We probably haven't.
Can you see me?
Yeah, go ahead, Bill. Yeah.
Well, while we're patting ourselves on the back, I'd like to remind all public officials, to include myself, all right, that we were unable or unwilling to fully fund the department until the crisis occurred. And I want this to be a history lesson, okay, for the future. And I want everybody to listen to what we're saying so that when it comes time to funding again after the pandemic fades, and so does our historical knowledge, that we remember to fully fund the public health department at the requested level. Again, I find this disconcerting to suddenly, hey, you did a great job when we underfunded you all these years. So in the future, lessons to be learned. This isn't the first or the last, but we really need to put our money in this particular health environment for our citizens. Thank you.
Thank you, Bill. Really good point. Thank you for bringing that up, Yolanda, too. Anything else from anybody? If not, I will call for a vote.
Councilmember Avila?
Yes.
Councilmember Gabler?
Yes?
Councilmember Geislinger?
Yes.
Councilmember Knight? Councilmember Murray?
Yes.
Councilmember O'Malley?
Aye.
Councilmember Scorman?
Yes.
Councilmember Strand?
Yes.
Councilmember Williams?
Yes.
Okay, it passes on a 9-0 vote. So does anybody want to do a picture while you're here? And let's give the resolution to Kimberly and Lisa, if that's okay. Yeah.
You bet. Thank you.
With this picture, we don't have to worry about people getting too close. We have our health department here.
Yes.
Show it off.
Thank you, guys.
Thank you. Thank you so much.